What are the medical complications of addiction? Withdrawal is a medical condition. Detoxification is not a clinical issue. It is not treatment. Detoxification is a medical condition, just like a heart attack, like a stroke, like diabetes, like hypertension. So someone comes to us under the influence or in acute or subacute withdrawal from a substance. They are admitted to our medical department to have that medical condition addressed. The first thing we have to do is to determine what substances are involved. And from there we have a whole catchment of protocols to address the safe withdrawal from that substance, whether that substance is heroin, pills, sedatives, benzodiazepines like Valium, Xanax, Klonopin, and of course the very most dangerous substance of all, which is alcohol. And we have a team of medical professionals that ensure that that patient will not have a seizure, and won't have any complications, and will be relatively comfortable so that they can begin to engage in what will become the treatment process in the therapeutic community. We do that by assessing them. And sometimes, well, not sometimes, most of the time, we have to get collateral information from the families. Addicts and alcoholics are notoriously bad historians. They don't want to tell us what's been going on. They're ashamed of what's been going on. They're traumatized by what's going on, and they are terrified that either they're not going to be adequately treated and something terrible is going to happen to them. So we often have to reach out to the referral source, to the family, to find out exactly what's going on and then create an environment that's safe for them. We usually like to get them comfortable, which means giving them more medication, which is sometimes confusing to people who don't understand addiction. But the number one problem with people with the medical condition of needing detoxification is that they don't have any life-threatening complication, like a seizure or become so sedated that their breathing becomes impaired or whatever. And so we have to find that balance. And we do that by taking blood from them, finding out what substances have been involved. We take urine specimens to find out what substances are in their system right now. We do breathalyzers, and we look at them. We take their vital signs, we take their pulse, and then we begin to slowly medicate them and safely withdraw them on what we call a taper. And depending on the substance, depends on the protocol, because at Seabrook House, in the medical department, we individualize care. There is no set protocol because everybody is different, and we have to look at that person. Somebody who is 60 years old, drinking heavily, taking sedatives because his doctor prescribed them is very, very different than the 18-year-old who comes in and just wants to get high.
Excellent. One more question.